Are you a man in Brisbane feeling constantly drained, irritable, or just not yourself? What if you could feel more vigorous, focused, and energetic in just 3 to 6 weeks? For many, TRT is that answer. This concerns more than just libido. We're talking about improvements to muscle mass, body fat, mood, and mental clarity. This isn't an abstract concept. It is a real medical option available right here in Brisbane. In this video, we'll break down the specific treatment options, the real costs, and the unavoidable risks you must weigh. First, TRT is a legal medical treatment, not a supplement. To qualify, you need a diagnosis confirmed by 2 blood tests. When prescribed and monitored correctly, TRT is a safe and effective treatment for a genuine hormonal deficiency. So, once you have that diagnosis, what happens next? What are the actual treatment methods you'll find in a Brisbane clinic? The most common methods are injections. You might have fortnightly primotestin shots, or the Riandrin injection once every 3 months. If injections aren't for you, there's the daily option. Testosterone gels like Testogel, applied directly to the skin for a steady dose. You may hear about tablets or implants, but these are not widely used in Australia because of side effect concerns and availability issues. You need to understand why this is an ongoing treatment. TRT manages symptoms. It doesn't fix the underlying cause of low production. A daily gel, a fortnightly shot, these choices affect your lifestyle. But the big question is, how do they affect your wallet? Let's talk numbers. The total annual cost for TRT in Australia typically falls between $1,650 and $2,300. Some Brisbane clinics offer plans starting from as little as $4.19 per day. Often, that's less than a daily coffee. But that price is a range for a reason. Your final cost isn't fixed. What's the single biggest driver of your final bill? So, the cost is definable. But a financial cost is one thing. What about the biological cost? Let's talk about the side effects. This is the most important trade-off. When you add external testosterone, your body's own production shuts down. Your testicles will shrink. The direct consequence of this shutdown is a significantly reduced sperm count, often causing infertility. This is a critical point to discuss with your doctor. Beyond that primary effect, there are other potential side effects. Many are manageable, like increased oil production on the skin, which can lead to acne. Other issues your doctor will monitor for include breast tissue development, known as gynecomastia, and hypertension. The most serious risks, like polycythemia, an increase in red blood cells, are rare. This is exactly why regular blood tests are required. Interestingly, some old fears about TRT are being challenged. Research shows it doesn't worsen urinary symptoms and may even improve them for some men. We've covered the benefits, treatments, costs, and risks. How do you put these pieces together to make a smart decision in Brisbane? Let's connect the dots. You're looking at a cost around $2,000 per year for tangible improvements to energy, mood, and libido in just 3 to 6 weeks. Earlier, I asked what drives cost variation. It's your dosage, matched to your symptoms, that most impacts the final cost of your plan. The choice between a gel and an injection isn't just convenience. It sets the rhythm of your follow-ups and the blood tests that manage risks. Finally, in Brisbane, the decision is bigger than just TRT. Clinics often offer total men's health services, from nutrition to ED treatment. So, what is the final verdict for a man in Brisbane considering TRT? What is the one takeaway you need? TRT in Brisbane is a well-established medical treatment with clear costs, significant benefits, and a structured approach to managing risks. The decision hinges on one trade-off. You exchange natural testosterone production and fertility for symptom relief. This is a long-term commitment. Your first action isn't choosing a clinic, but confirming a need. The mandatory first step is getting 2 blood tests to get a diagnosis. If you're in Brisbane and the symptoms we've discussed are familiar, the path forward is clear. Talk to a qualified doctor. Get tested, understand your numbers, and have an honest conversation about how TRT aligns with your health goals. It could be the first step. Find more information and resources for men's health and testosterone replacement therapy here in Brisbane.